Ever glance in the mirror and think, huh, are my eyes looking a bit, I don't know, yellow?
Hmm.
It's okay if you have, because today's deep dive is going to equip us with all the knowledge we need. We're taking a close look at scleral icterus. Yeah, we've got this fascinating excerpt here, and it really seems to break down everything, like what this condition actually is to what you should do about it.
Right.
So consider this your personalized deep dive into
Yeah.
scleral icterus. So let's just jump right in. What exactly are we talking about when we say scleral icterus?
Well, in the simplest terms, it's when the whites of your eyes, the sclera, take on that yellowish hue. And you're right, it's not like a disease in itself,
Okay.
but it's a signal, a bit like a check engine light, for your body,
Okay.
and more specifically, your liver.
A check engine light for your liver. That's an image that's hard to ignore. I've got to know more about this
You
connection.
might not realize it, but your liver, it's constantly working, right, to keep you healthy.
Right.
And one of its many jobs is processing bilirubin,
Okay.
a pigment that's basically left over when your body breaks down old red blood cells.
Hmm.
Now, when bilirubin builds up in the bloodstream, which can happen for a variety of reasons, one of the first places it tends to show up is in the whites of the eyes.
So it's like our liver is sending up a flare.
Yeah.
Like, hey, pay attention to me.
Exactly.
And I'm guessing ignoring that signal is not a good idea.
Not at all.
The excerpt we have really seems to emphasize this whole early warning system aspect of scleral icterus.
It's like a friendly reminder from your body to go check in with your doctor. Make sure everything's A-okay.
Exactly.
Early detection is key when it comes to, any health concern.
Right.
And scleral icterus is no exception.
Now, the article did mention that not every case of yellowish eyes is necessarily scleral icterus.
Right.
There's a chance of misdiagnosis. That seems a bit unnerving.
Yeah, you're right. It's not always a clear-cut diagnosis. Sometimes other factors, like, those completely harmless fat deposits that some people have,
Right.
can kind of mimic the look of scleral icterus.
So how do you tell the difference? How can someone be sure it's actually scleral icterus?
The key is the extent of the yellowing.
Hmm.
True scleral icterus will extend to the area near the cornea, that clear dome over the iris and pupil. It's a subtle difference. But it's one reason why, again, seeing a doctor is so important. They can help you understand what you're seeing.
It really makes you appreciate the value of a trained eye, doesn't it?
Hmm.
Speaking of which, there's this fascinating point in the article about skin tone and how scleral icterus might be the only noticeable symptom of jaundice for people with darker skin.
Yeah.
Can you elaborate on that?
That's such a critical point, and unfortunately, it's often overlooked. You see, in individuals with lighter skin, jaundice often causes, noticeable yellowing of the skin.
Right.
But for those with darker skin tones, that yellowing might be much harder to see.
So it's almost like a stealth symptom.
Precisely. And that's why it's so important to emphasize that any noticeable yellowing of the eyes, regardless of your skin tone, warrants a conversation with your doctor. Don't hesitate to advocate for yourself and seek professional advice.
That's such an important reminder, just trusting your gut and speaking up when something feels off. And it's interesting, the article also mentions some other symptoms that might pop up alongside scleral icterus, and they aren't all as obvious as you might think.
You're absolutely right. We tend to think of the liver as this behind-the-scenes organ, but when it's struggling, the effects can be surprisingly far-reaching.
Yeah, the article specifically mentioned things like itchy skin, feeling uncomfortably full after eating, even changes in, bathroom habits. Not exactly things that scream liver problem at first glance.
Right. It's like our bodies speak in kind of these subtle languages sometimes, That itchy skin you mentioned, it could be a buildup of bile salts, which is something the liver usually handles. And that feeling overly full could mean the liver's not producing enough bile for proper digestion. Even those changes in urine color or stool, often it's a sign that bilirubin isn't being processed the way it should be.
Wow. Okay, so let's say someone IS experiencing some of these symptoms. They see their doctor and scleral icterus IS suspected. What happens next? The article mentioned liver function tests, and honestly, that sounds kind of intimidating.
Yeah, I get it. Medical tests, they can sometimes feel like you're stepping into the unknown. But think of liver function tests as like sending your liver a friendly "how are you doing" message.
Right.
These tests measure these specific markers in your blood, and they're giving your doctor a peek into how well your liver is actually doing its job.
So it's not about diagnosing scleral icterus directly. It's more about figuring out the root cause.
Exactly. Remember, scleral icterus, it's a symptom, it's a clue, But there could be many, many underlying causes, from viral infections to autoimmune disorders, certain medications, even inherited conditions. Your doctor will piece together your medical history, any medications you're taking, lifestyle factors. It's like detective work.
And just like a good detective drama, I'm guessing the plot thickens when it comes to treatment. It can't be as simple as, like, here's an eye drop, you're cured, can it?
You're catching on. There's no one-size-fits-all treatment for uh, scleral icterus itself. It all comes down to addressing whatever's causing it in the first place, a viral infection. Totally different approach than, say, an autoimmune disorder.
The article did mention the word prognosis, which I always think of as like a kind of medical crystal ball. But it sounds like the outlook can vary quite a bit depending on what's going on.
Right. You got it. Let's take Gilbert syndrome as an example. It's a fairly common genetic condition, and it can cause these mild, rises in bilirubin. Most people with Gilbert syndrome live perfectly normal lives without any, major issues.
That's reassuring to hear, but I imagine not all cases are so straightforward.
True. Take cirrhosis, for instance. That's a much more serious condition. And basically what happens is healthy liver tissue gets replaced by scar tissue. It can lead to, a cascade of other health problems and requires careful, long-term management. So yes, the prognosis for scleral icterus, it's as varied as the conditions that actually cause it.
It really highlights how crucial a proper diagnosis is. Knowing what you're dealing with, it empowers you to ask the right questions, advocate for the best care possible. Now, before we wrap up, I want to circle back to something the article touched on. The terms icterus and jaundice, they're often used interchangeably, but are they really the same thing?
Yeah, it's true. Those terms, they do get, tossed around a lot.
Yeah.
And often, like you said, interchangeably. And essentially, you're right. They both point to that same root issue, too much bilirubin hanging out where it shouldn't be.
Okay. But if they both mean the same thing, why the confusion? Why even have both terms?
Well, I think it's all about context. Some healthcare professionals, they might use jaundice more broadly to describe that yellowing of the skin and eyes, while icterus might be specifically for, that eye yellowing we've been talking about. Sometimes it's about the perspective. Like, are we talking about a symptom or the underlying condition?
So kind of like how a cough could mean anything from like a tickle in your throat to, something more serious. It's all about digging deeper.
Precisely. But I think, honestly, for most of us, the takeaway is simple. Yellowing eyes, whether your doctor calls it jaundice or icterus or even something more colorful, it's a sign to get checked out. Don't get stuck on the label. Focus on getting the answers and the care that you need.
I love that. Don't get stuck on the label. Such a powerful message. And it really ties into everything we've been talking about today, right?
Yeah.
About listening to our bodies, advocating for ourselves.
Absolutely. This whole conversation, it's got me thinking about all the subtle ways our bodies try to communicate with us. We focused on the eyes today. But there are so many other signals that, we can learn to recognize.
That's such a great point. It's like our bodies are constantly sending us these little memos, if only we know how to read them, right?
Exactly. So here's something to ponder as we wrap up. If you notice a change in your eye color, whether it's yellowing, redness, anything unusual, what are some other subtle changes you might start paying attention to? Maybe it's your energy levels, your digestion, your sleep patterns, even your mood.
It's about connecting the dots, right? Our bodies are these complex, interconnected systems. And sometimes those seemingly unrelated symptoms, they're actually all pieces of the same puzzle.
Exactly. By tuning in and learning to decipher those whispers, we become more empowered to take charge of our health.
I love that image, learning to decipher the whispers of our bodies. It's like unlocking this secret language that allows us to advocate for ourselves in a whole new way. So listeners, that's your cue. Pay attention, trust those gut feelings, and don't hesitate to reach out to a healthcare professional if something feels off. Until next time, happy diving.